What up, Z-Pack? We're not frozen.
All right.
Yeah, tech, baby.
They don't notice it, but it's the third time we've tried
It's only
this.
the third time. You guys are never going to believe where I am. I am in Marana, Arizona, near Tucson, with the evilest of evil administrators.
That's right, I am.
Tell them who you are.
My name is Clint Kuntz, the CEO here at MHC Health Care.
So y'all are like, how come you aren't out there fighting the suits, Z-Dog? And I'm like, because they stopped wearing suits.
That's right.
Look at this.
He's got the suit.
CEO of a healthcare entity, right? Not for profit, serving the community for 60 years.
60 years.
One of the biggest and oldest in Arizona. Yeah?
The oldest in Arizona.
The oldest in Arizona. I'm the oldest in my company because the other two are 28 years old.
That's what you get for kids.
Exactly. And then the rapping doctor wears a suit. Makes no sense. But so Clint was kind enough to have me out to speak at their 60th anniversary gala tonight. And I'm really excited because you guys have been building Health 3.0 for like 60 years.
We have been. We've taken it to the next level by integrating other services as well. Full person health care for everybody who walks through our door.
You shut up. That doesn't happen.
It does.
It does.
And we can show you how.
Are we going to take a tour?
Sounds like a great idea.
I love it. And now they're saying they got no audio.
Uh-oh.
You know, I wonder if it is that internet. Let's see. What are they saying? Okay, fixed it. Oh, they have audio. They don't have audio. I can see, but no sound. Log out and log back in. Read my lips. No audio.
So we can stay here and just like...
Let's just keep... Yeah. Okay, here's the thing about nurses. Okay, they drive me crazy for all... No.
we love nurses.
We do love
anybody
nurses.
can hear, we love nurses.
And read lips. I'm a new BSN and not an evil admin soup. I hear you, so Deborah hears us. So just some people can't hear us. They have to log out, log back in. All right, That's probably why we only have 187 viewers, because they're like, where's the sound? But when they log out, see, it's all lies. Aaron Ryman?
There we go.
I'm glad I didn't say what was really on my mind,
Exactly.
okay? Because it would have gotten real. So
that was before we started recording.
Before we even started. By the way, let's show them this office. So Clint's...
my trashed office?
No, this. Look at these cool... So the Southwest. Yeah. I mean, you got heck of geckos. Do you see how I censored myself? I was going to say hella.
Hella.
And then I'm like...
You caught that quick.
I'm with an administrator, so I better say hecka, because I want to get pulled up on charges. So tell me about these geckos, man.
These are actually from my wife.
There you go.
I had nothing on my wall, and she felt like I needed something, and she's my better half, so she decorated.
This is a smart man.
I've been married 21 years
That's
now,
how you survived. You listen.
Exactly.
Yeah. I'm still struggling with the listening part. So what we're going to do is we're going to take a tour of MHC Health Care. Yep. This is our
main administrative building, or not really administrative. We have full clinical functions here. It's our largest facility. We have 15 locations around all of Tucson.
I love it. And you've been doing this for 60 years.
60 years.
And you also have federally qualified healthcare clinics as well, yeah?
Well, that's just a designation. A federally qualified health center is just a designation. We're a private nonprofit company.
Got it.
It basically just means that we get some extra funding to help pay for people who are uninsured care, that type of thing.
Well, what percentage
Small piece of our funding.
Yeah. So you're philanthropically funded, you're funded through insurance, you have multiple...
Exactly.
Yeah.
92% of our funding comes from patient revenue, just like any other practice. 8% comes from grants, philanthropic funding, other stuff like that. So we can serve anybody who walks through our door. We never turn somebody away because they can't pay their bill.
Wow, that's unusual. Are we sure we're in America right now?
We are.
Okay, because it sounds like communist land to me.
We're the actual solution to part of the healthcare problem.
Wait a minute. So, okay, now you're going to show us, guys. So the reason I wanted to talk to Clint before we do the show tonight is I wanted him to show us what some version of Health 3.0 might look like, where we take care of our most vulnerable patients without destroying the economy, breaking the bank, and wrecking the universe. Should we do this?
We should.
Let's go on a walk. All right. Hopefully you guys have sound. I'm going to read some comments while we're walking. Oh, wow. It can be done, says Loretta Taylor. Can you believe the gall of people thinking we can fix healthcare?
Exactly. We just have to frame the conversation.
That is exactly right.
We'll have to go down on the elevator so they'll get to see that quickly.
Perfect. Now, so in terms of framing the conversation, do you think we're framing it wrong in D.C. right now, the way we're talking?
We're absolutely framing it wrong, and I've actually made a couple of trips to D.C. to speak with them about that. The conversations they're having around healthcare are really around health insurance. And health insurance and health care are so disjointed right now that people have no clue what they're talking about between the two. You can fix health insurance all day. It doesn't touch health care that needs fixed.
So guys, Clint runs a very large healthcare system, okay? He's just said what we said yesterday on our show, which is the debate is about health insurance is not about health.
And they're having the wrong debates, the wrong discussions. Absolutely.
I got a lot of crap in the comments. So like, Z-Dog, you don't know what you're talking about.
He does know what he's talking
this
about.
suit,
Trust me.
this suit,
I deal
look,
with it every day.
He's wearing a suit. I'm not. Okay, you tell me who you're going to trust. No, you're having it every day. Oh, we better step off. Thank you. We're going to minimally try to violate. Let's see. There we go. We're back.
We're back.
Little Wi-Fi.
We're back and live.
I'll tell you, healthcare Wi-Fi is the best.
We'll try to break as few federal laws as we can.
But can we break some state laws? Because
Oh, I'm joking.
then you're a lot
We
like.
got a special waiver for that.
Listen, if you got waivers to break laws, then you're just like Turntable Health.
Hi.
How you doing?
Hi. Want to say hi to one of our
How are you doing?
MAs here?
We're Facebook live casting right now. Do you mind being on
Awesome. No,
on
I
the
don't
TV?
mind. Sure.
Do you know Z-Dog, MD?
I don't. Hello.
We're gonna teach you about rapping.
Z-Pack member.
There it is. There it is. What do you do here at MHC?
I'm a medical assistant.
Oh, an MA.
Yeah.
Hey, let's give props to the MAs. What up, MAs? You know we got your back. Woo woo. What's your favorite part of your job?
Ooh, that's a tough one.
Yelling
I
at
think
Clint?
oh yeah, yelling at Clint. No, just getting to be a part of the patient's recovery or just helping out.
Yeah.
Yeah.
Well, you have a wonderful smile, and that's gonna help a lot.
Thank you.
Thank you for talking with us. Oh, hi.
This is one of our great nurse practitioners.
You want to say hi to the pack?
Sure.
What's your name?
Alma Loveres.
I love it. And you're a nurse practitioner?
Yes.
And a family nurse practitioner?
Family nurse practitioner.
So you see all ages?
Yes.
What's your favorite age? Come on, don't lie to me.
Probably 2.
The terrific twos.
Yes.
That's what we used to call them because
Yes.
I remember I made the mistake in my pediatrics rotation of telling my preceptor, "Oh, we have a terrible twos in here."
Uh-oh.
And she said, "It is the terrific twos." And that cost me honors in the rotation. Yeah, because I was trying to be snarky. "Oh, the terrible twos." And like, "You're the terrible twos." And they pointing at me. Well, how do you like working at MHC? Is it a cool place to work?
Yes. I'm
Now,
very happy.
Are the administrators evil? Because I'm just looking at this guy here.
No.
We pay her to say nice things, so.
I wish my administration paid me to say nice things. They just dissuade me from saying evil things.
Okay. You put it that way. That's
I-
really-
I expect a check next month.
Oh yeah. Oh yeah. So thanks. So you're seeing patients today?
Yes, I am.
Are you coming to the thing tonight?
No.
She's not gonna see me.
It's her birthday.
It's your birthday?
Tomorrow, but I'm celebrating tonight.
I love it. Let's
Her
see
husband works for us as well.
Oh, you're kidding. So it's like, and what does your husband do?
He's also a family nurse practitioner.
I love it.
At Dovman.
Happy birthday.
Thank you.
Almost.
Thank you.
Are you Russian or Ukrainian by descent?
Bosnian.
Just the other day, I accused a Russian of being Bosnian, and now I did the opposite. I'm just the worst. My Russian radar is off. I'm sorry.
It's all right, no problem.
Thank you. Well, thanks for talking with us.
Of course.
Yeah, I'll let you do your thing because some of us have to
Let's
work.
walk this way.
Thanks.
Thank you.
Good to meet you.
Nice to meet you.
So we're in some of the medical space now. Looks like regular medical.
Yep.
Exam room space, nursing station.
Very beautiful, by the way. Very nice.
Here's another one of our awesome physicians.
Hey, we got a
Dr. Vajala.
Dr. Vajala, how you doing? We got the
Hey.
Z-Pack over here. So, what's your specialty?
Internal medicine.
I love it. Hey, you're a brother, I can tell already. Because
Yeah.
my dad is from Pune, and he told me, fatafat, go do GI. Why are you doing internal medicine? Because there's no money in it.
I know.
And he was right.
I
said
thought
all
there
the
was
money's in
money
the
in
colon,
sleep
right?
medicine and they did that, but
Didn't do it?
no.
I totally need CPAP, by the way. You know that, right?
Sure.
My wife says I snore all day long. All day long, which
All
is
day
strange.
long?
Yeah, it's not even sure how that works. Well, cool. Thanks for doing everything you do. Are you going to be able to come to the event tonight? Not tonight. Yeah, not tonight.
He's going to my birthday party.
Oh, okay. Now I'm understanding
No,
what's
we
up.
should have made her birthday party at the event.
It sounds to me like we need to have the party at Z-Dog's Talk, and
And
then
we'll bring you up on stage and sing to you.
Oh yeah. I'll be like, you got what I need. But they say he's just a friend. Well, so Clint, the evil administrator, is giving us a tour. Is there anything we absolutely have to check out here? Oh, we haven't said hi to you either. Let's get that going.
Selfie Queen.
Hey there, Selfie Queen. What do you do?
I'm a medical assistant for Dr. Vajala.
Heck yeah, MA. What's your name?
Alicia.
Alicia. Thank you for everything
Are
you do.
you live?
Yeah, I'm live.
Follow me, Alicia.
she's pimping her Instagram. She's like, yeah, slide into my DMs because like I'm Alicia D on Instagram. What's your Instagram?
Smart lady.
It's Ali Moni.
Ali Moni.
Yeah.
Do you see what she did there? I like that. Well, 377 people are like, oh, heck yeah, Ali Moni. Michelle.
She got some creepy followers stalking her tonight.
No doubt, no doubt. By the way, guys, like, have you already gotten a sense that the vibe at this clinic is a little different than your standard clinic? Like, people are laughing and having fun and they're still working? Like, that's how it can be in Health 3.0 when your administrator doesn't necessarily wear a suit every day and the visiting clown does. Always gives props to the ones that keep providers on time, says Amanda High. That's you, girl. That's you, because otherwise we're never on time. Because, you know, I got internet to serve. I got golf not to play because, you know, I've never played golf. But, you know, it's all good. So you want to roll us down through more awesome stuff here?
Awesome.
Yeah, thank you, guys.
Nice meeting you.
Thank you. A pleasure. Happy birthday.
Down this hallway, standard medical clinic, we turn into behavioral health.
Wait.
We're integrated.
So you do behavioral health, mental health?
We do full behavioral health services.
So kind of like a
All
patient-centered
specialties.
medical home, all of
We're
that.
absolutely a patient-centered medical home, but to the nth degree.
So elaborate on this. Tell me. So do you
So,
you have
these-
licensed clinical social workers? You have
We have psychiatrists, psychologists, therapists, case managers, you name it, we have it. Psychiatric nurse practitioners, RNs, all those services are available right here for our patients with the medical services, all working together as one team.
that is a lot of what we talk about all the time, ZPAC.
Regardless of their payer source. It doesn't matter if you're self-pay, insurance, Medicare, Medicaid, sliding fee, no money at all. We find ways to make sure they get the care they need.
So, you know, y'all wonder how I decide where I'm going to go talk and stuff. It's like,
It's a number of zeros after
it's
the
the number of
check.
zeros after the check. That's exactly what it is. And I'm telling you, these guys have no money. No, this is great. So again, integrated behavioral health is key because in my estimation, about 50% of what we see in primary care, it really has a mental health component.
Even more than that.
Yeah,
So
you're right.
The research shows, so you treat diabetes, I'm sure, all the time.
I pronounce it diabetes, but yes.
How many times have you had a diabetic patient who's also depressive, and that depression stops them from being able to take their medication and follow the regimen they need to treat their diabetes?
Absolutely.
And vice versa. That diabetes makes the depression worse. The research shows it both ways. So we treat both sides of that on the same patient with the same team.
I love it. And that's what we've been evangelizing as well. And when we were running Turntable, it was the same thing. It was, if you don't integrate mental health, behavioral health, the person's social stuff, like the social determinants of
The
health.
social term health are so important.
How do you guys manage that when you have a population that may be quite medically underserved?
They're very medically underserved.
Yeah.
When you look at our risk scores, they're much higher than your quote-unquote average private clinic you would see. But we manage that by treating those social determinants of health. So we take that into account. We have a housing program, for instance. Somebody needs housing, we get them housing. We
Wow.
actually have funding to do that type of thing.
Wow. So real true case management, really community service, community integration, those kind of things. How do you stay solvent?
Through lots and lots of sleepless nights.
Is that really what it is? I mean, I don't think you're kidding. Yeah.
No, so we have to get creative.
Yeah.
One thing we've gotten really, so my background actually isn't medicine. It's, before I went into medicine, it is private industry, manufacturing, business, IT. I did business analytics.
Wow.
I took that background and applied it to medicine
Yeah.
from that side.
Yeah.
And you start running things like a business, and you can serve so many more people.
So
we go out and we get contracts that pay us for outcomes. Not just pay me for so we're not paid for, okay, I want to see you today. I want to see you tomorrow, and I want to order these 10 labs. That gets us no more revenue. I'm paid on making sure you get what you need today.
So I want to unpack a little what you said because there's so much there that is crucial to our discussion every day of Health 3.0.
Yep.
And we've had discussions, Clint, where we feel that it really requires, okay, first of all, treating medicine as a business is a taboo discussion
It
topic.
sounds bad, but it's not.
Yeah, now tell me why it's not, because we've talked
Right.
about this, and I actually agree with you, but the way that you frame it to clinicians is very important, because if you're talking about just clicking boxes and bean counting,
I hate clicking boxes because that does nothing.
It does nothing.
That has nothing to do with quality, has nothing to do with taking care of the patient, and has nothing to do with revenue. Either one.
What?
It's horrible.
So,
I agree with you on that
So-
one.
so-
EMRs are evil.
Wow. Okay, so already we're agreeing on a lot of stuff, and the way you talk about mental health and integration is actually the way a clinician would talk about it. Now, so the question is, do you feel that your lack of clinical experience frontline affects your ability to lead this organization?
No, because I've actually gone back and gotten, so now at my background, I'm just finishing up my doctoral behavioral health degree.
Oh,
So
wow.
I got a so I have some background that way, and plus you just dive in and you learn it. All these years I've been doing it now. So
Yeah. Well, it seems like your staff love you, and you're running this thing, and the way that you talk about it is the way we talk about it, Clint, which is it's about outcomes. It's about optimizing the business process to actually allow us to generate the best outcomes.
Yep, absolutely.
And if you do that, that means doing good for our patients means doing well financially for all of us.
If you do it right.
If you do it right.
But you got to be very careful how you do it and which contracts you take on, how you take them on. Because the insurance companies, they're not out to pay you extra money.
Heck no.
They're out to pay you as little as possible
Right.
to get as much out of you as you can.
Right.
So we try to use them the same way.
Yeah. That's great. Keep walking. This is brilliant.
So this is pretty much down near the end of the hall here, and we'll go back out this door.
Okay,
here.
yeah.
But this is all more, behavioral health area. But as you can tell, when patients come in, nobody can tell what anybody's here for. We remove the stigma of somebody's coming in for mental health and walking through a door that says mental health, or walking through a door that says medical. We don't have that.
So, see, guys, this is also really important because especially young people, and on older people, they don't want that stigma of feeling like, okay, this is now a stigmatized mental health thing that people don't see as a disease.
Right.
They see it as
Absolutely.
a character flaw.
And so when I told you we're violating state laws every day,
Yeah.
this hallway
Yeah.
is violating state laws every day. We actually had to go to the state legislature 2 years ago and get special rules and regulations passed so we could do this. They told us we had to have a door right here between these areas and separate entrances and separate doors that said mental health and medical.
Right.
So
And
we
then
actually
immediately-
said, no, we don't. We're going to do this. They gave us a waiver to do it.
So this is the other thing. So Clint is talking about fighting for
Fighting the bureaucracy.
Fighting the bureaucracy for regulatory fluidity that allows us to actually take care of patients in the way that the clinicians actually feel it needs to be done.
Right.
And you're now studying behavioral health in a doctorate fashion, so you also understand the stigma issues.
Yeah, and integration. So the program, I work with ASU. So, and they have a program that really focuses on integration. And it's just awesome, the focus at that program and what they're doing. I know we're actually in Tucson, which is U of A territory, and it's a big rivalry between the two. So I can't say ASU around here very loud, or
Yeah,
I might
but
get something come flying out at me, hit me over the head or something like that. But yeah, ASU has done, they're world renowned as far as their integrative work.
Yeah.
Integrating medical, behavioral, taking care of the whole patient.
I love it.
So we've taken that and kind of applied that to hear what we're doing.
Now, there's some questions here. Fight
Yeah.
the power, says Rachel Hignite. Kate Nicole says, you're in my town. I work across town and didn't know about these people. Wow. So what's
Awesome.
up? Are you not advertising? What's going on?
We do little advertising. We don't do enough. Oh, absolutely. Advertising costs a lot of money for a little return. And we have just about as many patients coming through the doors we can keep up with.
So that's the thing. Like
We're growing so fast that we've got to keep hiring docs and keep hiring nurses and keep hiring all the support staff. So we don't really advertise a ton because we would get overwhelmed and would provide bad service.
Well, this is
I don't
gonna-
want
this is
somebody to
gonna-
wait a week to get an appointment.
this is
They can
gonna-
get an appointment tomorrow.
This is going to wreck your model.
That's okay.
This is going to go all around the world. Well, here's the thing. One thing I noticed, I've never been to Tucson. It is beautiful.
Tuscan, as you said.
Yeah, Tucson. Yeah, Tucson. Oh, you watch my show? I'm out. I believe Tom may have said something about meth because he's not highly educated.
He may have said something that nothing good is in Tucson, I believe was what he said.
Tom, are you watching right now? Because if you're watching, you're getting me in trouble, okay, with a guy that's actually really cool in a town that's actually quite beautiful.
I'm
because
not
I
from
got
here originally, so you can say whatever.
Someone
you want.
asked if you were from Ohio.
I am.
How did they know that?
Yeah, who was that?
Yeah, wait a minute, because I saw that and they were like, Clint, Rita Bonifield. Clint, are you from Ohio?
I absolutely am. Southeastern Ohio. I was born and raised in Appalachia. So I'm
Heck
well, I'm
yeah.
one of those hick back hills. people
Da-da-ding,
that-
ding, ding, ding,
Exactly.
ding, ding, ding. I love it. This is awesome, man. I knew I had a connection with you because I'm from Clovis, California, which is like, woo.
Exactly. Same idea.
I love it. It's not Iowa or Idaho, that's for sure, says Lisa Gallagher.
Maybe it's the accent,
That's what it is.
gives
Yeah,
away
Carrie
every
Bennett
time.
says, yes, Ohio. Replicate this all over the nation, says Mark McMurdy.
We actually are.
Oh, what? Tell me about it.
So community health centers are the largest primary care network in the nation.
Wow.
2,000 across the nation. We take care of more people in primary care than any other health system.
So tell me about this community health clinics thing. Is this a corporate thing or is this just
No.
a model?
No, what that means is our board of directors is actually made up of our patients.
Ooh.
So my bosses are the patients.
What? Dude, I bet you are. I get you're handing out a lot of turkey sandwiches and warm blankets.
It's
That's
actually
wait. That's how we
it's
did
an
it at
awesome model of
Turntable, too.
care. Yeah.
Really, wow. We used to have a quarterly patient panel that we would sit and we would try to make the clinic better with them.
Yeah. So they actually serve on our board of directors.
That's tremendous. That's tremendous.
Yeah.
I love it.
And they're involved in every decision we make.
Show me some more of this magical
Yeah.
place.
Let's
This
go
is
down
like
this way real-
this is
let's
like a
kind of
small
circle
world
back
ride.
around.
I love it. So Z-Pack, you can see now. Part of our mission with the show too is to travel to bright spots around the country and shine a light on things that are working and things that aren't working. And
So this is kind of the waiting room for that area. As you saw, they were pretty much done for the day because
Yep.
it's Friday afternoon, and they all want to come see you speak tonight. So
except for everyone who's not coming, because
exactly.
they're going to what's her name's birthday.
we also do women's health in this area.
Got it.
OB/GYN.
So
all this
OB/GYN,
service.
yep.
Yep.
Obigine, you have failed me for the last time. And so,
Back-
well, this
takes
is a
us back
really,
around.
guys, Z-Pack, I'm just going to flip this around so you can see a little bit of the landscape around here.
Yeah.
Hang on.
And
I don't know if
this
we can
covered
see
parking
that.
out here is also all solar powered.
Solar powered and,
We have 90% of our power from solar.
wow, you guys are green AF.
This
as the
building
kids
is
say.
lean certified.
Oh no! Don't say lean to me. I actually like lean. I like lean when it
Meant
actually.
lead.
Oh, LEED. Sorry, LEED certified. Yeah, so it's green AF. But you said you talked about business analytics.
We
process.
use Lean Six
Tell me
Sigma
about
for
lean.
everything.
So do you do Gemba walks and like all these?
We do all that fun stuff.
Yeah.
Fishbone diagram. We do it
Yeah.
all.
Now you're going to get a lot of nurses right now who are going to start rolling their eyes at you, and you're lean. But why is lean useful for Health 3.0 and building something better?
Because there's so much waste in our current system, and I can remove as much of it as possible.
Got it.
So Lean gives you those tools to remove waste.
Got it.
So when your administrator comes to you and says, "Hey, let's do a Lean project,"
Yeah.
try it. It'll work.
Got it. All right. Now what I'm going to do is if we
So
go
this
in
is
here.
our dental area.
Oh.
So I wanted
cool,
to show
guys have
you.
dental, too.
We don't just do medical behavioral health. We take care of the dental as well.
I love it. And I'm just going to make sure I keep any patients off the footage here.
So we take care of the whole needs of the patient.
Wow.
Yeah, we're pretty busy in dental
So-
right now, so we probably don't want to walk through there. We might.
Yeah, we'll see some
Violate a little
patients.
bit of-
Yeah, let's not violate dental HIPAA. Is that a thing? Is there
I
dental?
don't know.
Yeah.
That's a good question.
Right, well-
Let's try it and see.
Hey, Z-Pack, let us know. So we have a lot of dentists in the Z-Pack. They can tell us. Dental too. Wow, says Katie Miller. OMG Dental. Wow, Christy Columbus. See, and I mean, from a social standpoint, this is how you take care of people. You take care of the entire person.
The
Behavioral
entire
health.
person.
Teeth are part of people. There's a
Exactly.
oral systemic link.
Too often we take care of between here and the ankles. We even cover up podiatry. We're great at not taking care of the feet either.
Yeah,
you
that's
know?
true, yeah.
Most systems don't take care of the feet. They don't take care of the head. By the head, I mean mental health, dental. Why is all that separate?
Yeah.
It's
yeah.
all so interconnected.
It makes
you
no
have to take
sense.
care of the whole patient.
I agree. Like nose hairs. No one takes care of my nose hairs, and now look. It's
You
like
want
a
to lower the
forest in
cost
there.
of care, you've got to take care of the whole patient.
Yep. Awesome. So where are we going next?
Let's head down. and we'll
Okay, I'm
go
gonna
down towards the
make sure I
pharmacy.
avoid any patient. There we go. Okay. I'll turn it this way. Hey, that's my boy Steve. He's my handler. That means that
Keeps you on time.
He keeps me on time. He wakes me up in the morning at noon when I wake up. And all right, let's read some comments, and I'll keep.
Yeah, so
keep
this is our main lobby.
very beautiful.
Again, it's Friday afternoon, so we're dying down a little bit.
Yeah.
Family practice, pediatrics over here.
Look at this. Rachel says, this can't be real. I don't want to go back to work now. You're going to have more recruits.
Awesome.
I do want to say one thing, and I was talking to Steve about this.
MHCHealthcare.org. Come apply for a job.
It's true. So they are always trying to look for people. And,
Oh, yeah.
And I got to say, of what I've seen so far, Tucson, this part of Tucson, and particularly Marana is beautiful. And this clinic is really nice.
So we have a pharmacy over here.
Oh,
but also,
yeah,
What I
my
really
pharmacy
want to show
bag.
you is over here. This is a really innovative
Try to
thing that we
avoid
do.
that. Excellent.
So when you have a sore throat,
Yeah.
what do?
You cry to your doctor about getting unnecessary antibiotics?
If you can even get into your doctor,
That's
right?
true.
So
Or you use
we
Dr.
decided-
Google and find out you have a neck cancer.
Exactly.
Right.
You're dead. You're
Yeah,
dying.
and you're gonna die.
So what we decided to do was put in our own urgent care.
Oh, sweet.
So our patients can walk in anytime.
Hey, same
and
day,
we,
same
we
day.
run it just like a primary care visit.
I see.
So they're not billed extraordinary rates that are outrageous.
They don't get the ER rates.
No, exactly.
They get a 9923
Functions
whatever.
and looks just like any other urgent care.
Oh yeah.
But
Very cool.
you get treated.
And I'm not going to flip the camera around just because there's
Yeah.
some patients in here. Yeah, that is fantastic.
And we'll walk this way. So we
Yeah,
can-
yeah. And let me just cover the camera for a second here. There we go. Never let it be said that Z-Dog is not HIPAA compliant. Sea-Dog is totally HIPAA compliant.
I don't think any of us are HIPAA compliant all the time.
Okay, can you believe this guy is actually one of the more enlightened administrators I've ever heard? Because
I think we're safe. Yeah.
oh yeah, are we good? Oh
we're
yeah,
good.
perfect. Here we go.
So
Hi.
this is our lab.
Oh, dude, you can find me
We have
in the
our
lab.
lab.
Can I run in here?
Yeah.
Okay, check it out, Z-Pack. You can find me in the lab, bottle full of crap, but mommy, you got the plates. If you're into growing that, you're gonna have to wait, though you wanna have it stat. So come give me a hug if you ever want it back. Oh, there's some people in here.
Who is that?
Hey.
Hey, I'm enjoying.
No, I trying to reconnect. See, it's so typical lab. It's like, nope,
Yep.
nope. We are to be heard, not seen.
They
Thank you.
Work and work. They don't have time.
I love it. And it's time to spin these samples in a circle. Oh, hi. Oh, yeah, no. It's pointing at me. It's pointing at me. You're good. You're good.
Yeah, you're not.
But I can turn around if you like. No, dude,
my
you got your own built-in beauty filter, girl. You want to say hi to Z-Pack?
No.
Oh, what do you do?
Lab tech.
Lab tech. Come on, say hi to the Z-Pack.
No, thank you.
They're going to love you.
No.
All right, you want to give them a shout out to all the lab techs out there? Just say what you'd like to tell the other lab techs.
You're not on camera.
You're not on camera, just audio.
Oh, I don't even know what to say, honestly.
That's perfect for a lab tech. I love it.
So instead of being seen and not heard, they're heard,
They're heard but not seen.
There you go.
I like that.
I love
We
it.
got
She's.
our X-ray.
Thank you.
We do X-ray. We do mammography. DEXA scan.
Dude, I totally want a DEXA scan. I'm gonna find out that I'm so osteopenic. Oh, it's backwards. Oh wow, look at that.
So we can throw you in there.
You know what? I'll pass. Next time. DEXA's Midnight Runners.
You can do a mammo, you know.
I love it. Oh, look at this, the zombie crossing zone. Can I creep in here real quick or something? Oh, excellent. So here is Mamo, which is, of course, as you know, a zombie crossing zone. I mean, who doesn't know that? By the way, Donna Sapatafore says, as a lab tech RN, that is a pretty sweet clinic lab.
Awesome.
Give it up, brother.
All right.
You're killing it right now. You want to say hi to the Z-Pack? All right. How you doing?
Hi.
What up?
Hi.
What do you do?
I'm the Mamo tech.
Oh, heck yeah. So it's about squeezing.
Squishing. Tighter the better.
Does it hurt a lot or?
Not super comfy, but I probably won't ruin your life today.
That's good. Now, do you do? And this is a serious question. I'm a physician. I know there's male breast cancer. Do you do male mammos ever?
We don't.
Okay.
I have in the past, but here we do screenings only.
Okay.
So any male needing a mammo would be a diagnostic.
Okay.
So
So
we
are
send
you
them out.
willing to make an exception for me and do it right now?
If you would like me to, I would.
I will pass.
Okay.
Do you want to give a shout out to all the mammo techs and raid techs out there?
Definitely.
Yeah.
Because next month is Breast Cancer Awareness Month, so we know
October.
100% survival rate with early detection.
I love it. And people are saying, giving you shout outs. And this is in Arizona, Shelley. Yes. Hell yes, it hurts, but it saved my
Yes.
life, says Lisa McGraw. I
Awesome.
love my
Thanks,
mammo
Lisa.
techs.
Get your mammos.
Says Jacqueline Pevney. Awesome. Thank you for
Awesome.
taking
No
time with us.
problem.
Love it. Look at all the Halloween October gear in that mammo.
We got to say hi to Richard.
Yeah,
He's
we do.
been with us for what, almost 20 years.
Almost 18 years.
18 years. He's been
18
with
years, right.
What up, fam?
Us. Richard is
Hello.
an X-ray.
Your X-ray tech?
X-ray.
I
Yes.
love it. I love it. So, what's your least favorite exam to run?
My least favorite would be lumbar spines.
The dreaded LS spine that almost gives us no useful clinical information anyways.
But Richard
So,
is as good as any radiologist at looking at those.
oh, I bet. But he's probably not allowed to tell patients.
No,
Yeah.
he's not.
No.
They never are. But you're like, oh yeah, you got degenerative facet.
We see you go.
Yeah.
You know that
No,
it's
it's true.
bad.
When you see the text, when the texts are like, oh, then you're like, okay, I'm just gonna go ahead and fill out that life insurance
Yeah,
form
we're
now
gonna have to
before
send
we
this off and have somebody look at it.
Exactly.
Let me go bring you a CD real quick, just in case you gotta go somewhere.
How long? You've been here? How long?
Almost 18 years.
Wow. Thank you for your service, man.
Thank you.
That's fantastic. What a great crew you got,
Cool.
man. This is really
Awesome,
fantastic.
man. We'll get back out this way.
Yeah,
Circles
thank you,
this
brother.
around.
This is so much fun. Oh, that's a nice room. Ultrasound.
Their office.
I love it. I'm really, all joking aside, hey, how you doing?
Another
Okay,
provider?
I'm so angry at you right now, Clint, because I want to show you guys what this office says, okay?
Do you know Z-Dog?
It just says provider. And it's in Braille, just in case. And it's like, wow, how generic is that? Why can't it just say, person who cares for others or something? I demand satisfaction here, Clint.
We could. It might say that in Braille because I don't read Braille.
Oh, that's true. That's true. Hi, how are you? I won't show you on camera because I think there's patient information on there, but nice to meet you. I love it. People are like, who's that purple dude
Now
creeping behind us?
We just went from all that right into pediatrics. It all flows together.
I love it, man. Look at that. So it's all connected. We never even opened a door. You know, you remind me of the dude who paints. It's a pretty little elephant. We just go ahead and draw a pretty little trunk on there.
No, that's trees.
That's just a pretty tree.
little
There's
tree.
a little cloud over there. A pretty little cloud. That's the community health clinic thing.
Another
Hey.
pediatric nurse practitioner.
Hey, how are you? Oh, I'm sorry. Pediatric nurse practitioner? You mean, I'm sorry, Clint, because it says here provider, okay? I'm so angry right now. I can't even speak. Hi. No, hang on. Nice to meet you.
Nice to meet you.
How are you doing?
I'm good.
So what is it like taking care of little adults?
They're not just tiny adults. It's chaos. You should have been here 10 minutes ago.
Oh, what happened? What went down? No,
Well,
don't tell any patient
No,
names.
no,
Yeah.
can't say anything personal.
Yep.
There was his dad.
Okay.
He works full time.
Yeah.
It was clear he had never been home alone with them.
Wow.
There was 3.
Wow. Oh, and then, okay, you don't even need to say anymore because that is all I need
Getting
to
too
know.
much.
It's too much. I love it. I like
Don't violate HIPAA.
But you know, I'm just saying we already know what happened there because
already
I'm a
did
dad
that
who's
earlier, so-
yeah, exactly. Me and Clint have already violated several state and federal laws just by
Do the police
talking
watch
to each other.
this?
Yes, many of them do. Actually, we have many law enforcement officers who watch, and they are fans of what we do, and they want to help build 3.0 in their own way. So we got to give them props.
Awesome.
We got to give them props.
President of board of directors is the lieutenant in the police department.
I love it.
You'll get to meet him.
And you're tonight.
Yeah.
I won't be coming then because the police and I don't get
worn
along. I'm just kidding. I'm just kidding. I love the popo. Wait, what? What are they called? The police? The popo.
The popo.
No, seriously. We've talked on the show many times about the connection between law enforcement, healthcare, and how we all work on one team. And when those connections fray, it becomes very difficult for all of us to work together. So we're trying to make sure we span those divides as much as we can. Darling,
Police, fire, everything. We have them here all the time.
we do what?
Police, fire. The fire department's here probably daily.
Oh, police.
least.
Yeah.
least daily. With-
Yeah.
Yeah.
Bringing in patients, taking patients away.
Both, yeah.
Any last parting words for the Z-Pack there?
Nope.
I'm
Have fun tonight.
Oh, there's gonna be fun. You're not coming either.
I can't.
You know what?
Sorry.
I'm starting to get the sense that these people don't like me, and I appreciate them for that because they have taste.
You're fantastic. I just couldn't go tonight. I'm sorry.
You are absolved, my child, and thank you so much for
Thank
your
you.
time. Thank
Have
you.
fun
Thanks for
today.
all that you do. We will.
Some more of our awesome MAs.
Hey, how you doing? What up, fam? Oh, sorry. She's like trying to talk to patients, and we're like, "What up, fam?"
Is there any,
This way.
are we safe that way, Steve? Or
Steve's
trying to run
Steve's on
any-
HIPAA
wanna try to run
patrol.
any patients?
Yeah, definitely,
Violate anybody's
definitely, because this is a
privacy?
live show. Hey, y'all, how you
say
doing?
hi to
You guys want to say hi to the Z-Pack? No, we got 2 no's. I think that's fair. You are the only smart people in here. Yes, ma'am. I do. I
You
have
wanna be
several
in
videos.
it? We're doing it right now. Come on.
We're
You wanna
live
say hi
streaming to
you?
330 people. Nope.
Oh,
No.
my.
She's a smart person. Thank you guys. Appreciate it. Let's see some comments here, Clint. Oh, yeah, no.
Got some comments?
No, we're good on the HIPAA here. I'm just going to cover that. And we'll go somewhere. Where can you take me? Perfect.
All right.
There we go. We'll face
There's not
this
much we
way.
can violate in here.
Here we go. You know what? We'll face this way because that way the light is better. Here we go.
Awesome.
All right.
What do
So
we got in comments?
let's read some comments because people are super stoked to hear it. Whoa. Hello. Take us with you, Z. Francie Darnell. Well,
All right.
can they come?
Absolutely.
Do you have room? Steven's
do.
shaking his head. He's like, don't.
I think you got a couple tickets left,
just-
right? We
there's-
put in the back of the room.
It's a rather nice dinner. He has one empty table. How many square feet is this facility? Says
This
Lavon.
facility is 75,000 square feet.
Wow. That's
The building beside us is another 30,000 square
that's
feet.
that's almost as big as my house in Las Vegas, but not quite.
Yes, we actually have two facilities. The other one we haven't gone to, that's the Counseling and Wellness Center. We do a lot of other high needs intensity behavioral health services.
Got
as
it,
well.
got it. Fantastic. My hometown of Marana. Yay, says
All
Robin
right.
Jewett. I love it. Hi there, friendly folks. Need one of these in Florida. Shelley
And
Morocco
there
Hicks.
most likely is.
Yeah.
Just go on the internet, search for your local community health center or federally qualified health center.
I
They
love
both
it.
really kind of mean the same thing.
They're the same
we
thing.
do not work for the federal government. Don't let that name scare you.
Yeah, because
That
then,
just means we get some funding to help pay for indigent care.
'Cause
we
otherwise-
also get tort protection.
ooh, you get tort protection. So
We get tort protection.
what does that mean? Elaborate
you
on
can't
that.
sue me. You have to sue the U.S. federal government.
I'm coming
You know how
here.
many problems with healthcare that fixes?
Yeah, right, right. That's why you guys are smiling so much, because you get to actually do the right medicine instead of the cover your butt medicine.
Exactly. Which is another reason we're not incentivized to order tests and to order all this extra crap that you don't need.
Guys,
We're
listen.
incentivized to take care of the patient.
Okay, this is how we're gonna bring this full circle.
See
Well-
what I told you,
well,
Health 3.0 version 2. We're
th-
there.
They're already at 2.0 of 3. So you guys have to understand, and it's not perfect, and I'm sure there's going to be people who are like, well,
Oh,
I had
there's-
a bad experience. And
Oh, absolutely.
That's always the case.
And there's still lots of issues we have to fix as well,
Sure.
especially on the payment side.
Yep.
But again, we have to detach health insurance, health care. We're figuring out health care.
Yeah.
Health insurance is a whole other issue. It's a train wreck.
Yeah.
Paying for health care is the problem, and
Yeah.
you know.
Yeah.
That's what we got to fix.
Okay, so I want to say this. People ask me a lot of times, Z, like, how are we supposed to transform healthcare when, whoops, here we go, when the administrators are just beholden to the Health 2.0 construct and trying to get paid and, business. But here is an administrator, Clint, who runs a really fantastic center in a place serving people who are actually quite underserved. And so it's not like we're just taking care of the ultra rich. It's not a
No,
concierge
we take
clinic.
care of the hardest patients you can imagine to some of the best.
Yep.
We have the full gamut.
The full gamut, and best in terms of payment reimbursement, right?
Yeah,
yeah,
exactly.
yeah. Not in terms of moral judgment.
They're all
because-
awesome. We love
Exactly,
all our
exactly.
patients.
But except for that one guy. Just kidding. But the thing is, so you can see when you have enlightened administrators working with providers who actually care about doing the right thing for patients in a place that's built to support them and the patients, you get great care. You get 3.0 happening on the ground. And that's the purpose of today's interview, is to show a bright spot. And I'm really honored to be able to come and talk with you guys. And
We're excited to have you.
it's really a thrill. Everybody I've met has been so amazing. And so
Great.
hopefully I'll let you down tonight. Hopefully I'll get arrested.
I'm sure you will.
Of course I will.
We
And-
gave out tomatoes to everybody.
Good. Hopefully they're
Hope you're
raw.
okay with getting smacked with it.
No, I demand it. It's good for the bags under my eyes. Z-Pack, let's say thanks to Clint and everyone at MHC Health Care for being so amazingly awesome. And there's a patient coming, so we're going to end it. We out.
Thanks,
Peace.
everybody.